Dr. Poornima. I'm consultant obstetrician and gynecologist working in Ankura Hospitals for women and children, Bodupal branch. So today I will talk a few words about the common gynecological problems that affect women. The common gynecological problems are mostly include the abnormal uterine bleeding, which is the commonest complaint that we see in our gynecopy and accounts for almost 30% of all the OPD. Then the next would be pelvic pain and urinary problems, breast problems, sexual problems, psychological problems, and also white discharge or leukorrhea. So a few words about each symptom. So this abnormal uterine bleeding can be because of various factors, and it is easier to talk in terms of the age. So each age, according to the age, in the pubertal age, abnormal uterine bleeding is usually because of hormonal disturbances like PCOD or the immature HPO axis. And in the reproductive age group, it is mainly because of the pregnancy complications or some abnormalities like the fibroids or polyps. In the perimenopausal age women, again, it is because of the hormonal imbalance, and it can be because of even precancerous lesions or fibroids, endometriosis or adenomyosis. Postmenopausal bleeding is an entirely different entity and needs to be investigated thoroughly. The next complaint that we commonly encounter in our OPDs is the pelvic pain. This pelvic pain again can be that pain associated with the periods and pain not linked with the periods. So pain during periods, as we call it, that is called dysmenorrhea. So this dysmenorrhea can be either primary or secondary, and this pain is usually crampy type and usually present in the lower abdomen and low back pain. It is associated with vomiting, nausea, headache, loose motions. The other cause for this dysmenorrhea is when we have certain pathologies like patient is having fibroids or endometriosis or adenomyosis or pelvic inflammatory diseases, when she can present with pelvic pain. Pelvic pain can be because of non-gynecological reasons also, which can be orthopedic reasons like sacroiliac joint problems or the disc problems. Then it can be because of urinary problems also, and nervous problems like the pains like sciatica. So this is about the pelvic pain. The next common problems that the patients usually present with are the breast problems or pain in the breast or lumps. So painful breasts are quite common, called mastalgia, and it is usually because of hormonal imbalances and fibrocystic diseases in the breast. Then in the later ages, it can be because of the lungs can be because of any malignancies, which needs to be thoroughly investigated. The next common complaint is the urinary problems. So in urinary problems, the patient can present with burning sensation, incontinence, or hematuria, we call it, that is passing of blood in the urine, or she can present with retention of urine. Retention of urine is the patient is her urinary bladder is full, but she is not able to pass urine freely. So these are the common urinary problems. Next problems that we encounter are the sexual problems, which are quite common in the women who are newly married. They usually present with some urinary symptoms or dyspareunia like painful intercourse or bleeding after intercourse, or it can also be some urinary disturbances. Some women are have the fear, and even nowadays couples present with non-consummation of the marriage, that is, they are not able to perform intercourse. So they need a lot of counseling, and most of the time counseling is enough. Then the last symptom that we encounter in the gynec OPD are even psychological symptoms. Some women, especially in the perimenopause women or postmenopause, because of the hormonal imbalances, they present with mood swings, depression, postmenopausal symptoms. So they need to be counseled accordingly. So these are the common gynec symptoms that we see in our outpatient clinics. Thank you.